Hello, I'm Barbara Head, and today I'm talking with Kim Arrington, who is a hospice and palliative care social worker. Kim, could you tell us a little bit about your work in hospice and palliative care? How long have you been doing this?
I have been doing this work for 18 years. I came to it from working for the state of Kentucky, and so I've been here with hospice for 18 years.
Wow. And have you worked with different populations or done different types of hospice and palliative care social work during that period of time?
I have. I've actually worked in different venues. I started out as the pediatric social worker with Hospice of Louisville, and I did that for about 7 years, but in that time I also worked with nursing home patients, I worked with home team patients, and I worked on the inpatient unit.
So a variety of venues.
That's right.
That's great. So there's a lot of different opportunities for social workers who want to go into hospice and palliative care.
There is. Yeah, you can, if you're inclined to want to be in a facility, there's the nursing home team or the inpatient unit.
And you worked for a while in an oncology practice, right? As a representative of hospice?
Well, actually, yes, I did. There was a contract between Hospice of Louisville and an oncology practice here in Jefferson County. And I did that for 8 years. And that was not so much to do hospice work, but the doctors wanted to have an individual in the office, in the social work position, who had an understanding of the kind of healthcare continuum in relation to cancer and hospice care.
Great, great. So what drew you to this type of social work? There's a lot of opportunities in social work practice. What drew you to palliative and hospice type settings and that kind of work?
When I was first out of the Kent School of Social Work, I took a job that was somewhat adversarial in relation to social work client relationship. And while I found it interesting and definitely worthwhile, I really wanted to do something that I felt might be more rewarding, built more on positive relationship with patients and families. So that's at the point in time when I went into the pediatric hospice work.
I see. I'm sure a lot of people comment and say, boy, that must be hard work or difficult work, or you must be an angel to do that kind of work. What keeps you doing it? What really keeps you being able to do this after 18 years?
Well, it's I find it very challenging. No two families are the same. And I actually just read something yesterday in a book about dealing with us as care providers, the professional at the end of life with our patients. And it was talking about culture and cultural diversity. And one comment that really stuck with me is that it's not just race or ethnicity, but every family and their patient is a culture unto themselves. So every day is a new day.
Right.
And there's no 2 days are the same, and just when I think I've seen it all, there's a new situation that comes down the pike that is a challenge.
Right. Absolutely. So you work with an interdisciplinary team. And I'd like for you to tell us a little bit about your role on that team, what you see as bringing to that team.
I think I was thinking about this before I came today, Barbara, and I think one of the roles that I would say is most key is that of the advocate. The social workers are, I think, trained to uniquely be very conscious of who our client is. And even though the team is all in there for the patient and the family, Sometimes what that patient wants can get lost in what we think is the right thing to do, what we think is the medical thing to do, the right medical thing to do, when really it's all about that person, the individual that is bringing us all there in the first place.
Right.
That's the reason for the admission. You know, social workers, I like to think, have a bag of tricks. You know, we're trained to do lots of things, to be the advocate, to know the resources, to know, you know, who to call to get something done or in place for a patient and family. So we're just uniquely placed, I think, on the team to not do the spiritual and not do the medical. As somebody told me the other day, you do the practical things. So it is kind of a lot of, it's a lot. It's a lot of things we do.
Right.
And everything we learn today is something we will use tomorrow, and it just builds on itself, the knowledge we have and the skills we use.
Well, core to palliative care is that it is patient-centered, and I think the social worker's in a key position because of our focus on the value of self-determination.
Exactly.
And we are those advocates that always cut to the core and express and advocate for what our patients would want in these kind of situations. So that is extremely important. Well, how do you communicate with this team? How do you all know where everybody's coming from, and how do you all keep that focus on that patient and implement that plan of care?
Well, thank heavens for all the new technology, I guess I would say. We do have a team meeting every 2 weeks that we sit down and we are all in the same room at the same time talking about our patients. We do it a lot of ways. Voicemail is intricate to what it is that we do, make a visit, report back to the team, because it's unusual that after the first visit we're all in there together. So we use voicemail. The text messaging is really helpful. I might go into a house, and even though I'm not the medical expert, I've done this enough to know when somebody's in pain or when there's a symptom change or when somebody needs to be looking at this patient. So I'll either call or send a message to my co-worker that they need to call or visit. And the same with the chaplain. You know, I'm not a spiritual care provider, but again, you pick up on things that are needed, and I'll call that person and give a report and say, I think it would be good for the patient or the family for you to call and follow up. And we work very hard at knowing what our job is on the team and keeping within our own professional framework and boundaries. But we also work hard at knowing when we need to pass it on. And you know, the nurses are the first to say, I would never work without a social worker or a chaplain, because they realize the full scope of what we are providing and that that's not what they do.
And just like you don't put in catheters or give injections, right? Or
exactly.
order medications. So.
If I'd wanted to, I would have been a nurse.
right. So you kind of walk a tightrope sometimes, I'm sure, when you're in a home and you identify a need from another discipline. You do have to respond in a way and be helpful to the patient,
you
do communicate with your team members and get the appropriate person in as soon as possible. Well, I know over 18 years you've probably worked with a variety of teams, and could you share what you think makes up a good team?
One that's willing to work together, that really spends time understanding what each other does, and you know, for people new to the field, that can be a real challenge. In any discipline, it's a challenge, but to not work as lone rangers, so to speak. To be really good at reporting back, maybe be willing to do joint visits together. I think that's where the social worker comes in, is, you know, calling a family meeting to gather everybody in that patient's world together so that everybody's on the same page.
Right, right.
I think being willing to, what was your question again? I'm sorry.
What makes a good team?
Okay.
So
working
we don't
together.
we don't want a lone ranger.
We
on
don't
the
want a
team
lone
that,
ranger.
that
That's
wants,
not teamwork.
Right, right, right.
I think that just knowing who to call and when, and being willing to, you know, maybe, I think we all have to admit when that's not what we do. You know, we have to admit that we don't know it all,
Right.
that our answers aren't always what we want, and the answers we want aren't always the ones that are best.
Right. So you have to be willing to learn from your team members, as well as being willing to teach them what you do. And I would imagine you also have to be somewhat willing to be vulnerable, because you do have these other team members that are observing your practice and know how you work. So sometimes we need a little bit of positive criticism from other people to make us the best we can be. And I'm sure that in good teams, there's that open give and take where
That's right.
you learn from each other.
And holding each other accountable. You know,
Right.
if somebody's kind of gone too far, or maybe their boundaries are getting a little blurred.
Right, right. Or they need a little self-care.
They need the exact
Say
yes. The
yes.
self-care is a big thing.
Well, is there anything else you'd like to tell learners about the role of the social work and the value of what you do?
Well, I don't think you want to go to a hospice palliative care type work if you're just needing a job, because it's very much a challenge to you professionally and personally.
Right.
I think you have to be aware of what your buttons are and where you might get pulled in, and what's going to hook you and make you possibly not very therapeutic.
So if you have some of your own grief work, or you're not comfortable with death and dying, then probably you're not ready for this type of work.
It's like I said, it's not a job, it's a calling, really.
Right.
I mean, it's something that I think is evidenced by people who have worked a long time in the hospice here, and maybe leave and come back.
Right.
You know,
right.
that it is something that you feel called to do. And to me, it's work that's a privilege.
Right.
It's a privilege to be with patients and their families at one of the those times of life that are full of lots of emotion and
right, right. It's almost a sacred space.
Sacred,
to be
sacred time
with people,
right?
As they approach the end of life. And
Right.
So very meaningful work with its own set of rewards.
That's right.
That's right. Great. Well, thank you so much for your time today. I'm sure that just talking with a real palliative care hospice social worker has been very helpful to our learners as they try to understand the various roles of the team members.
I hope so.